One, two, 1, 2, 3.
Amanda is one of up to 350,000 Americans living with multiple sclerosis, or MS. But that doesn't prevent her from making music. She's joining other patients and leading neurologists to help you learn more about multiple sclerosis. You'll also hear from an exceptional athlete, alpine ski racer Danielle Daquani Umstead.
I learned to live with it, I learned to compete with it, and I learned to be my very best with it. And I didn't think that was possible when I was diagnosed.
This is a very optimistic time for the treatment of multiple sclerosis.
Multiple sclerosis is a disease of the central nervous system. That means the brain and the spinal cord and the nerves behind the eyes.
Nerves carry information between cells in your brain and spinal cord. They are like wires, insulated with a fatty layer called myelin.
And when that insulation is damaged, when the myelin is damaged, current leaks out of these nerve fibers and the fibers don't transmit nerve impulses well.
In people with MS, the body's immune system begins to attack the myelin.
Multiple sclerosis is felt to be an autoimmune disease. What that means is the immune system, which is normally there to protect us from foreign invaders, bacterial, viral infections, parasites, malignant cancer cells, and to get rid of those, for reasons that we don't really understand, starts to target part of our own body.
The symptoms you feel depend on which nerves are affected. If the nerves behind the eyes are attacked, you might have vision problems.
If it's in the spinal cord, you may have sensation abnormalities or difficulty walking or things like that.
Sometimes damaged myelin can recover. That is why some people with MS have symptoms that come and go. Those fluctuations are why the most common form of the disease is called relapsing remitting or simply relapsing. Over time, however, nerve fibers themselves can be damaged. This may lead to a gradual decline in function. But each person's MS story is unique. Long before being diagnosed with relapsing MS, Danielle Umstead faced a different challenge. She lost most of her vision as a teenager. But though legally blind, she became a Paralympic alpine skiing champion. Her husband, Rob, is her teammate, guiding her down the slopes at speeds up to 60 miles per hour.
Coming 85-2.
They won a medal in Vancouver, and the future looked bright.
After the 2010 Paralympic Games, my husband and I were super excited to get back on snow because we believed we were going to be the next gold medalist.
But after a long day of training, she felt a strange tingling sensation in her legs. Figuring it was a reaction to the cold, she went to bed. Overnight, her symptoms became worse.
And I remember waking up that morning and it was asleep or numb from my rib cage all the way to my foot. And I said, Rob, there's seriously something wrong. And he was like, let's get you to the emergency room. He had to help me walk. And it was really scary. I thought I had a stroke.
When they found out she had relapsing multiple sclerosis, it was a terrible shock. They would have to put their dreams of a championship on hold.
I remember being in a fog and just thinking, what does this mean? What does this do to my wife? What does this do to our family? And what does this do to even our career?
But Danielle and Rob are used to overcoming obstacles, so they started finding a way to rebuild their future.
Now I have another team, a team of doctors that help me on my healthcare issues and how to live with my multiple sclerosis and ways I can be better in my sport.
Scientists still do not know exactly what triggers MS.
We know that the immune system's involved, and it's in fact a hyperactive immune system because it's attacking your own tissue, but we don't know what sets it off.
As research continues, some risk factors have been identified. MS affects women more than men, and it's more common among whites than those of African, Asian, and Hispanic backgrounds. But the disease is not directly inherited. Research suggests a possible link between MS and early exposure to some kinds of viruses or other infections. One link, however, is clear.
Probably the most notable risk factor is smoking. Smoking turns out to not just be generally bad, but specifically bad for multiple sclerosis.
Smoking is associated with more rapid progression of the disease. That risk is lower if you quit. But leading a healthy lifestyle does not mean you are protected from multiple sclerosis. Matt was an active 32-year-old when he found out he had it.
So all I could think about was that I had a 3-year-old boy, our first son at the time, and the thought of not being able to play with him and run around with him and throw him up in the air was really upsetting to me.
That was more than 10 years ago. Matt and his wife Verna now have 3 children. He coaches their soccer teams and works with his own healthcare team to manage his relapsing MS.
Initially, it was a little bit scary, but we were able to move on and just live our life.
MS is an extremely variable disease in terms of the symptoms it produces.
Most people experience their first symptoms of MS between the ages of 20 and 40. They might have problems with their eyes, such as pain when the eyes are moved, dimmed vision, or a distortion of colors. Another common symptom is numbness, or a sensation of pins and needles.
But a lot of people ignore that because, you cross your legs, you get numb. If you get numb for a day or two and it's not bothering you, people tend to blame it on something else and they may not go to the doctor.
And symptoms might go away for a while before people do anything about them. Amanda is a professional jazz musician. She was just getting started on her career when she first noticed something wrong.
In college, I went numb from the neck down on the right side of my body.
She could still play the guitar, but she took time to see a healthcare provider, hoping to find out what was causing the numbness.
And they said they couldn't find anything, so it went away, and I kept practicing, and I kind of didn't care because I could still play.
Many years later, when she was diagnosed, Amanda realized she had been ignoring a range of symptoms. She would blame her tingling shoulder on her guitar strap.
And then I'd get this thing in my left eye, it'd get a little snowy, it'd go away.
Other potential signs and symptoms of MS include tiredness or fatigue, muscle stiffness, problems thinking clearly, or being able to concentrate and remember things, bladder problems, difficulty walking, and a depressed mood. Since many of these symptoms could have other causes, getting the right diagnosis can take time. The first step is to see a neurologist.
A neurologist is a physician who's trained to treat diseases of the brain and spinal cord and nerves. And multiple sclerosis is a disease of the brain and spinal cord and nerves.
Symptoms of MS mimic those of many other disorders. The disease is usually diagnosed by ruling out other conditions, but that process might not begin the first time symptoms appear. Matt went to a doctor when he started feeling strange sensations in his legs and feet, but they went away and he let it go. Then he was struck with a new set of symptoms.
It was hard to see, I couldn't type, it was hard to hold things in my hand, it was hard to go to the bathroom, and I went to the hospital and I was admitted.
But even then, Matt didn't find out what was wrong right away.
There's no one test that diagnoses multiple sclerosis. So look right here.
After asking about your medical history, the neurologist may do a series of tests, including checking your reflexes and sensitivity to touch. An eye examination looks for abnormal pupil responses or changes in the way the eye moves. Magnetic resonance imaging, or MRI, of the brain or spinal cord looks for scars, called lesions. A lumbar puncture, or spinal tap, may be performed, checking for signs of increased immune system activity in the spinal fluid.
Ready, go.
You might also be asked to take a walk down the hall to see if your legs and mobility are affected.
Ready, go.
Examining the gait, is the ability of the patient to walk, is very important, and we routinely do a test called the timed 25-foot walk, in which we observe how a person walks over that distance, but we also time them.
With all these factors to consider, patients might have to wait to get a definite answer about what's causing their symptoms.
But the fundamental way of diagnosing MS is we have to satisfy what we call dissemination in space and time. What that means is that we have to have evidence that there's more than one part of the central nervous system affected, and that the disease has been active at more than one point in time.
When the diagnosis finally is made, the news can be hard to take in.
I cried hysterically. I thought that my life was going to come to an end. And Andre, my husband, was waiting for me in the waiting room, and I mouthed the words to him as I was walking by, "I have MS." And then I just kept crying, and didn't know what I was going to do.
Amanda began to feel more hopeful as she learned more about MS. So did Matt and Verna. Once they knew what they were dealing with, they could start moving forward.
It definitely felt good to get a definitive diagnosis, and there's so many treatments and new treatments out there that there was a plan in place.
There have been bumps in the road, but being able to getting a diagnosis, taking it head on, and having a plan, that felt good.
Amari is a college student majoring in fashion merchandising.
I love everything that has to do with beauty and feeling beautiful and being creative. I love to be creative.
She was in class at the age of 18 when she suddenly started feeling a range of frightening symptoms.
I felt tingling feelings in my right arm and leg, and I couldn't move. It was very painful for me. I couldn't stand up straight.
The school nurse sent her to the hospital. The diagnosis came that very same night.
Around 11 at night, they told me that I needed to get an MRI, and that's what I did. And that's when they found out that I had lesions in my brain. So that's when they discovered that it was multiple sclerosis.
The news was frightening, but her doctor delivered it with some reassuring words.
He told me that many people live with MS, and that I can still have a long-lasting life with MS.
MS has several forms and appears differently from one person to another. People have symptoms in different parts of their bodies and at different levels of severity.
The most common form of multiple sclerosis is what's called the relapsing remitting form. And that's where individual will have an attack, and then a period of stability, and then another attack and a period of stability.
When my neurologist gave me the diagnosis, he explained to me that I had relapsing remitting multiple sclerosis, and he explained also that I would have a lot of ups and downs. Sometimes it'll get worse, and sometimes it'll be better.
And then time goes on, and then something else happens, another episode. So each of those is called a relapse or an attack or an exacerbation. Those words are used synonymously.
A less common form of MS is called primary progressive. Patients experience a steady worsening of their disease from the start with no distinct flare-ups or remissions. With the form called secondary progressive, people typically have an initial period of relapsing remitting MS, followed by a steady worsening with or without relapses.
And in addition to those three types, we further characterize the disease or subcharacterize diseases, whether it's active or not active, and whether it's progressing or not progressing.
In the past, about half of those with relapsing remitting MS progressed to the more serious form of the disease within 10 years of diagnosis. Thanks to research and new treatments, the outlook is much brighter now.
Increasing evidence suggests that by treating the disease early, we're likely to make a significant impact on the long-term course of the disease.
Danielle and Rob Umstead compete as a team. She cannot see what's coming next, so he tells her through headsets in their helmets.
I'm telling her when I'm starting my turn, when I'm finishing my turn, anything that's going on with the hill, things she's going to feel underfoot. It's like a little dance. We come down the mountain one behind the other and we kind of synchronize our turns and try to go as fast as we can.
So it's constant communication and obviously constant trust that gets me down the mountain at 60 miles per hour.
Trust and communication are also important when it comes to working with her neurologist.
It's a teamwork that is essentially the same as the teamwork that I have on the slopes. You need a lot of trust, a lot of communication, and you need to be able to work together to figure out what's best for you and your treatment.
Today, there are many medical options to help people with MS. Some medicines may slow the progression of relapsing MS and may also reduce the number and severity of relapses. It's important to understand that treating MS early may delay the onset of symptoms and reduce symptom severity. For patients with relapsing remitting MS, medicines called disease-modifying therapies have been shown to reduce the number of attacks, reduce the risk of further disability, and reduce the extent of new lesions in the brain and spinal cord.
Disease-modifying therapies in multiple sclerosis are so named because they alter the course of the illness. So in the past, and with many other neurologic diseases, we're treating symptoms, whereas disease-modifying therapies alter the natural history of the disease.
Disease-modifying therapies may be taken as pills or capsules, injections, or intravenous infusions. They need to be taken on a long-term basis.
Initially, the idea of injecting myself with something was terrifying, and now it's become so routine that my husband says, "Did you just take your shot?" And I said, "Why, yes, I did." It's amazing what you can get used to when you have to do something.
But injections may not be for everyone. Danielle's vision limitation meant she needed her husband to give her the shots. That was interfering with her independence.
I went to my neurologist and told him that the injections were not going to work for me, and he came up with another prescription, which was an oral medication, and that works for me.
Each person's body or disease can respond to these medicines in different ways. As we've said, good communication with the neurologist is essential to finding the right treatment program for you.
Patients should be very clear in reporting any symptoms they have, any side effects from medication, any concerns, and of course, any questions.
I know this sounds like a real cliche, but there's no such thing as a stupid question when it comes to asking your doctor about something.
And be sure to tell your healthcare provider if you're pregnant or hope to have a baby.
Multiple sclerosis is a disease that much more frequently affects women. And because MS affects people in the prime of their lives, naturally we're going to be dealing with a lot of women who have concerns about having a family, becoming pregnant.
Men who wish to father a child should also talk to their healthcare provider about issues related to their treatment.
So surprisingly for some, in the MS Center, we do a lot of family planning.
Neurologists may use a variety of treatments to help patients manage symptoms or the side effects of medicines. Mental health issues may also be addressed.
Depression is an issue that confronts a lot of patients with MS, and we as physicians need to be attuned to that, because the good news is that it's very treatable and it's manageable in the same way that people who get depressed and don't have MS can be treated.
Patients and caregivers might feel anxious about the cost of managing a long-term condition. This is a matter to talk about candidly with your healthcare provider.
Cost concerns are a growing concern for the medical community as well as the general population.
Talk with your neurologist if you have any concerns about sticking to your treatment plan, how your medicine is working, or any side effects you may be having.
So one of my MS colleagues used to say, MS is a marathon, not a sprint. So I think that the patient and the caregivers as well have to be completely comfortable with the treatment program, with the management program. Everybody's got to be on board.
Matt has an extra advantage in managing his relapsing MS. He's married to a physical therapist. Verna helps him stay on course with his treatment plan and be as active as possible.
Living a healthy lifestyle is very important to both of us, not only to help manage the disease, but to make sure that we're healthy for our kids and set a positive example.
Actively engaging in healthy behaviors may reduce your MS symptoms and improve your overall health and mood.
We advise people eat a healthy diet, get some exercise. We think exercise is good.
Ask your healthcare provider about getting the nutrition and exercise that's right for you. You might find you need to avoid heat. Some patients are affected by hot, humid weather, a hot bath or shower, or even a fever.
They may get transient new symptoms or transient worsening of previous symptoms.
Heat is my enemy. I overheat. I get really cranky. If I get really overheat, my limbs stiffen and my eyesight gets a little funny and I feel like somebody's hit me in the head with something.
Amanda compensates with clothing that keeps her cool. And instead of running outdoors in the summer, she gets most of her exercise inside.
I do yoga and Pilates, both of which are great. I really think they're wonderful.
If you smoke, talk to your neurologist or other healthcare provider about quitting.
Smoking weren't bad enough for a million other reasons. It makes your disease worse, and it also increases the likelihood that a person would get MS.
Find ways to reduce stress. There is no clear evidence that stress makes MS worse, but it certainly doesn't help. Another factor in your well-being is getting enough sleep. MS symptoms can make this challenging. A range of approaches can improve sleep and reduce nighttime waking, including avoiding caffeine, regular exercise, pain medicines, and sleep medicines.
Because it's gonna just make your day go easier when you wake up knowing that you had good sleep last night. You're gonna be more energized.
But before you consider any additional treatments on your own, talk with your healthcare provider.
Lots of people use what are called alternative and complementary medications. It's a nice way of saying unproven.
The problem with these agents that you can get in health stores is they haven't been required to undergo any kind of rigorous scientific testing.
It can also be helpful to connect with others, especially people who understand what you're going through.
The hardest thing for me is opening up to people and telling people I have MS because they don't know what it is and I don't always have the answers because I'm still learning.
There is a range of support available for people with MS, both in person and online. Amanda volunteers her time to talk with people who have just learned they have MS.
I reach out to other people who've been diagnosed with MS because I remember how terrified I was. If there's one person that I could help, then that's a good thing.
The single most important thing that can exist in a person with MS's life is a supportive family system or a supportive caregiver.
Let's crank up the resistance a little.
Danielle knows she can count on Rob to help her stay motivated and moving toward their goals.
My husband definitely pushes me physically, and more importantly, he helps me mentally. He pushes me when I can't get out of bed to get out of bed, or go to the gym, or just go for a walk, because there's those days where I don't want to move and I feel like I'm not able to move, and he's the one that helps me every step of the way.
Their son Brockton is a big help too.
When I was diagnosed, my son was a toddler, and he has watched me go through many ups and downs. He comforts me when I'm sad, makes me laugh, and he's just always there by my side. He's the very best medicine that anybody could have.
That was Dr. Miller's.
Caregivers not only help with everyday tasks, they also may be the first to notice signs of frustration, depression, confusion, or other problems.
And they need to also come with the individuals to their appointments because they can provide very important communication to the physician as to how the individual is doing.
Nowadays, Matt often goes to checkups alone. But when he was first learning to manage the condition, Verna came along.
Being able to have a kind of another set of ears definitely helps. She hears things that I don't hear. Another thing about Verna that's really important is I'm a little bit, I'm a worrier, and Verna's very calm and level-headed. No, she's like the calming influence, and so having that calming influence like really makes things easier.
But the support person for a patient with MS also needs support.
We need to protect caregivers because, especially in the circumstance where the person with MS may be disabled, that makes a lot of not only physical demands, but particularly emotional demands on the caregivers.
Reach out for help from family, friends, or an MS group in the community. 4 years after learning Danielle had relapsing MS, the Umsteads were back on top of the mountain at the Winter Paralympics in Sochi, Russia. They won their most precious medal yet.
It meant more to me because I didn't think it was possible when I was diagnosed with multiple sclerosis that I would even be back on the slopes. And actually, we were back on the slopes winning a bronze medal.
As we have said, each person's journey with MS is different. It's important to remember having this disease does not define who you are.
We like to say, you have MS, but MS shouldn't have you.
MS does not have me.
By working with a neurologist, you can develop a plan that's best for you. Communicate with your healthcare team about how you're feeling. Bring them your concerns and your questions. And remember, if you're feeling good, that means your plan is working. Stick with it.
When you go on a good streak, when you're feeling good, you can feel totally normal. And even sometimes, there have been times where I question, wait, do I really have MS? And if you're feeling normal, it's, well, maybe I don't really need to take this medication, or maybe I don't really need to do this. But you have to.
Keep a strong communication with your doctor. Make sure that, you have a good support system.
My advice to those of you that are out there living with MS is never to give up, never to give in, and never let the disease define you or your life.